Pregnancy tests. What are pregnancy tests? Pregnancy tests are simple urine tests that show whether you are pregnant or not. They test for a specific hormone, human chorionic gonadotropin, HCG. When a fertilized egg is attached to the lining of the uterus, HCG is produced. HCG is only produced when the woman is pregnant. Here are some of the most common questions women ask about "Am I pregnant?" tests. What should I ask before taking a pregnancy test? What are different types of pregnancy tests? How safe are EPT pregnancy tests? Is there any free pregnancy test? What to do when you think you're pregnant? What to do if I think I am pregnant? When should I start seeing a doctor for pregnancy? How reliable are online pregnancy tests? I have earliest possible signs of pregnancy before missed period. Can I take a home pregnancy test? When should I take a pregnancy test? Is online pregnancy test good? It is recommended to take a pregnancy test as soon as you see a missed period or you think your period is late now. Some pregnancy tests can provide accurate results even before a missed period. Read the instruction on pregnancy test box to see when the test will deliver best results. The tests become more accurate when you get closer to the date of your expected period date and become more effective when you missed your period. There are websites offering pregnancy tests online, but verifying their authenticity is vital before considering them. There are different ways to conduct a pregnancy test. We are reviewing all the ways here. Home pregnancy test, HPT. There is a different type of home pregnancy test kits are available, costing around $15. These kits are used to test pregnancy at the comfort of your home and can be used right after you have missed your period. There are some HPT kits that are not very sensitive and can be used to seeing a missed period. How home pregnancy kits work. Home pregnancy kits detect the hormone called human chorionic gonadotropin, HCG, a type of hormone which is present in the urine, a type of hormone which is only produced in your body when you are pregnant. There is a chemical used in these kits changes its color when it comes into contact with the hormone HCG. Every kit comes with its instruction and time duration. However, the average time taken is 10 minutes in delivering results. What must you know about home pregnancy kits? There are some precautions which you must know before using home pregnancy test kits. Every kit comes with different applicator and instruction, but they all work similarly. It is always recommended to use more than one HPT kit since they are inexpensive. It will provide more accurate tests. It is recommended that the test should be taken more than once on different dates, once at the very first day you miss your period and also after missing your period, to get better results. In some women, detecting HCG levels early are difficult. Home pregnancy kits may vary regarding their use, applicator and instruction, but they are easy to use. Every woman can use them in the comfort of their home. These kits provide 99%-100% accurate results, only if they are used correctly. How to know about the HPT kit accuracy? 9 out of 10 pregnancy test kits provide 100%, 99 out of 100 times, accurate results, only when they are used right after a missed period. They only become less effective when they are not used correctly, used too early, or if its expiry date has been passed. What if the pregnancy test kit is positive? If you have used home pregnancy test kits and get a positive result, it means you are pregnant. After getting a positive result, you should immediately visit the healthcare provider near you to confirm the news. The healthcare provider will conduct some other tests. A healthcare provider can confirm the pregnancy and discuss the other options with you, in case you are unsure about what to do. Moreover, he or she will assist you by suggesting right type of prenatal care if you want to keep your pregnancy. However, sometimes women can receive a false negative or missed period negative pregnancy test. Here is what it means. What is the meaning of getting a false negative? Getting a false negative or missed period negative pregnancy test means you are pregnant but home pregnancy test shows you aren't. Why you get a false negative? In some cases, women used HPT kits too early, the time when their HCG levels are low and cannot be determined. HCG, a hormone, indicates pregnancy. The hormone has developed anywhere from 6 to 1 days after ovulation. Another reason for getting a false negative is not knowing the ovulation date. In some women, the date is quite unpredictable because it happens on a different day. This is truer with women having an irregular cycle. Why you get a false positive test result? Getting a false positive means you are not pregnant but your home pregnancy test show you are. When women don't follow all the instruction written on HPT kits, they increase the possibility of getting a false positive test result. This can also happen when you read the test before recommended reaction time, 3-5 minutes. Or you have used an expired test kit. And in case you are taking some infertility treatments, or given HCG injections, there are chances to get a false positive. Women undergoing cancer or other medical conditions may have higher HCG levels that can affect the efficiency of HPT kits. What should I do when I don't understand the result? Sometimes women find it difficult to understand the result of home pregnancy test, or they cannot understand what false negative or false positive is. To avoid such confusions, to confirm pregnancy it is recommended to go through some clinical tests, conducted in clinics, healthcare centers/gynecologist. Visiting a healthcare provider not only confirm your pregnancy but help in deciding the best option and prenatal care. What are clinical tests? These tests are conducted under the supervision of a medical practitioner or gynecologist. These tests are conducted to check your urine or blood for a hormone called human chorionic gonadotropin, HCG, a hormone that is produced right after a fertilized egg is attached to the walls of the uterus of women. How does clinical urine test confirm pregnancy? A urine test is taken to confirm pregnancy and is usually performed at a clinic or healthcare center. However, the urine test is quite similar to HPT test kits, but they are taken under the supervision of a medical expert. That is why you will get accurate results by eliminating all possible mistakes. The test accuracy rate is 97% to 99%. However, a clinical urine test is comparatively expensive than home pregnancy test kits. Some doctors suggest blood tests as well to confirm a pregnancy. However, blood tests are performed in specific cases only. How does blood test confirm pregnancy? To confirm pregnancy often, your gynecologist recommends going for a blood test. The test is conducted in the laboratory to detect the presence of HCG in your body. Blood tests are used to determine HCG levels in blood earlier than urine tests. How many types of blood tests can be conducted? 2 different types of blood tests can be conducted to confirm pregnancy. They both have different efficiency levels. Quantitative HCG blood test. The test will determine exact levels of HCG levels in your blood. The test is used to find the lowest levels of HCG. These tests are conducted to check the concentration of HCG that will help in tracking any problems during pregnancy. Blood tests are often combined with other tests to determine a tubal, Ectopic pregnancy or to determine fall in hCG levels when she conceives after a miscarriage. Quantitative hCG blood tests provide more accurate results and often given priority over quantitative one. Qualitative hCG blood test. This test will only determine the presence of hCG in your body and gives an answer in a simple yes or no to pregnancy. Doctors often recommend this type of test with 10 days after a missed period to confirm are you pregnant. What should I know before undergoing any tests? In some cases, determining hCG levels is difficult because of an irregular cycle. That is why doctors use different methods. They may repeat different times with the gap of some days to get accurate results. They often recommend an ultrasound. Why does doctor recommend an internal examination to confirm my pregnancy? Doctors sometimes recommend going for an internal examination to confirm a pregnancy within 2 weeks after a missed period. The doctor will examine uterus and cervix, the lowest part of the womb/uterus. And if you are pregnant, the doctor can see a change in size, color and texture of uterus. It will turn soft and grow. These changes can happen in early weeks of pregnancy and are considered to be the early signs of pregnancy.